microphone, right? Y'all know I'm serious with it now, dog. Y'all done went and got me a microphone. 5 years later, I finally got a mic. That should be good. I feel good how I'm looking. I'm still handsome. Big Money Bound TV, RRT Posse YouTube. If you're new to the channel, welcome. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time. Today's video, I'm going to let y'all know the changes that the NBRC, the National Board of Respiratory Care, has made to the board exam, which is going to make it much more easier to become a registered respiratory therapist and get to this money. They literally doing everything but putting the money in your hand. It's finna be sweet, but if you ain't, hey, I'm telling you, if you in that field, you finna become a therapist, you got smooth selling to becoming a therapist. You wanna know more? Shit, all you gotta do is keep watching. Just keep watching.
What we represent, man?
Big money bound.
Say, let it know, man.
Big money bound.
The kid, man. You got the kid, man.
Now, I'm giving you straight facts from the NBRC website. This ain't nothing that's just coming from something I'm pulling out of thin air and Randy always making stuff up or he don't know what he's talking about. This shit is... Y'all forgive me. I ain't did a couple YouTube sit-down videos in a while, so y'all forgive me. This stuff is coming directly from the National Board of Respiratory Care. This is the article that's on the National Board of Respiratory Care website, nbrc.org. Anybody can go and look at this stuff. That's where I got it from. It says, examination changes coming in 2027. New details added. So let's check this out. Because from what I read, they making it easier, but they're saying that it's going to be just as difficult. But if you read in between the lines, they saying they're making it easier. You got to really listen. It's like, not only do you got to listen, you got to understand and comprehend. So some of this vernacular, some of these words they may try to use may throw Big Money Bound TV. Keep watching. All right. It says, at its April 9th, 2022 meeting, the NBRC Board of Trustees voted to make a significant change to the examination system for certified respiratory therapists and registered respiratory therapists. Credentials which will be implemented in January of 2027. All right, so this is what they finna do. This is what they saying they finna do. The NBRC is transitioning to a single examination. Okay, when you say we transition into a single, that means you just had multiple. Now you going to one. Shit, already that's less difficult. Already you telling me I don't gotta take as many exams as I had to take before to become a respiratory therapist. We're transitioning to a single. Who don't want to hear the word single instead of taking multiple damn? All right. NBRC is transitioning to a single examination to further minimize barriers to graduates as they enter the profession while maintaining the standards of excellence associated with CRT and RRT credentials. Do you see what that shit just said? Or do you hear what it just said? What they said, let me tell you. Transition to a single examination to further minimize barriers to graduates as they enter the profession. We minimizing barriers. So man, if I got barriers put up and I minimize them barriers, is that gonna be less difficult, right? It's gonna be much more easy. I went through barriers to get mine. I don't know how you gonna get yours. But if you ain't got as many barriers, I ain't mad at your shit. You graduated when you graduated, and now it's much more easier for you, which it is. But let's keep reading, because they trying to say, well, it's gonna be just as difficult, but you said you minimizing barriers. I went through all kind of barriers and roadblocks and shit, bro. What about how I feel? If you took the board exam more than twice to pass, you should be reimbursed some of that money. That's all I'm saying. NBRC, I should be reimbursed. I went through barriers. They didn't. Hey, don't worry about it. Don't even worry about it. I got my money. As you may recall, the Board of Trustees made an important transition in 2015 by removing the second multiple choice examination that candidates had to take to earn RRT credentials. So this is a continuation of those efforts. But in 2015, when they removed the second examination, I guess they had a, because I didn't take it. I didn't take the old one. They had a CRT examination. Then once you pass that, you pass your CRT examination, you got to take another RRT examination, which was all like multiple choice questions. When it was my turn, you had one multiple choice examination and you had a CRT cutoff score and an RRT cutoff score. Now, once you got that RRT cutoff score, you didn't have to leave that multiple choice 25% out of each 4 selections and go take a clinical simulation. Actual, as if you went inside a hospital, this went wrong, patient came in, smoke inhalation, having trouble breathing, what do we do next? Shit, I ain't never. I'm saying you gotta get urine, get ABGs, check this, get blood pressures and all. I'm in the damn hospital. But now, you gotta take one examination. But hey, I ain't mad at you. But it is much more easy. Now let's see if y'all can follow me along now. Okay. The new examination will be called the respiratory therapy examination. NBRC, y'all gotta get me on board, dog. Y'all gotta talk to somebody like me. The new examination will be called the respiratory therapy examination. What the hell was it called in the first place, bro? It was a respiratory therapy examination. Ah, man. Well, I tell you. Okay. Y'all, just keep up with me, bro. 2 cut scores that determine whether passing candidates receive credentials as a CRT or as an RRT. Okay, so they still doing a cutoff score, but it's just going to one test. Low cut score earn the CRT credential, and those who achieve the high cut score earn an RRT credential. And that's it. And I that's it. And I'm saying it's much more easier because currently you got to take a CRT exam and then you got to take a RRT exam to then be able, no, hold on, that's not it. You got to take an exam and you got a CRT cutoff score and an RRT cutoff score. I know multiple people that can't get the RRT cutoff score. I know some people that stuck at CRT on this examination. I know some people that got the RRT cutoff score but can't pass the clinical sims. But with this situation, as long as I get the RRT cutoff score, I'm an RRT now. You feel me? So those people that can't pass the clinical sims and they got an RRT cutoff score on this current exam, are y'all gonna count that when the new one come in? Or do I gotta take another exam to get an RRT cutoff score on that exam to be an RRT now? That's how I know it's gonna be an easier pathway. It's people been in the field for bro, I met people in Texas, I know people currently who can't get the RRT credential because they can't pass that clinical sims. I had to take it twice. I'm not joking now. I went back the next day and I passed it. But now they say if you fail one time, you gotta wait 3 months to take it again. Come on, NBRC, man. Let them people get the money. Let them get why do I gotta wait 3 months? I think I knew why. The failed attempts was just stacking up too high. It's okay, wait, we gotta stop this. Let's give everybody some time to keep studying, then come back. Because they coming back 2 days later and just failing again. But I passed mine the next day. So now it goes on to say, man, I believe that this one here is they're going to tell you how it's less barriers, but it's still just as effective and difficult and it's challenging. That ain't really true, bro. The respiratory therapy examination will be assembled in 2 sections. One to assess the candidate's breadth of knowledge and one to assess their depth of clinical judgment. The clinical judgment was that clinical sim, and that shit was 3 hours. That was 4 hours long, and the test was 4 hours long. So that was 8 hours of testing. Now you only got one test for 4 hours. But hey, I ain't mad at you, but it is much more easier. The breadth of knowledge section will be organized around the same content domains and cognitive levels that have guided development of the therapist's multiple choice examination. The depth of clinical judgment section will be organized around the following elements of the current simulation exam. So that section, the clinical judgment section, is going to be organized around the following of the current simulation. So now you're giving me a section of multiple choice questions of the current 3 hour damn simulation where I got to do 4, 5, 10, you got to do 10 scenarios, 10 to 12 scenarios, picking this and picking that. You're going to shrink that down to a section and tell me it's just as challenging. NBRC, talk to me, man. Because come on, we could have wrote this here a little better, man. Could have came straight up, hey, you want to be a respiratory therapist? It's getting a lot easier. Go get that cheese. Stop all this writing. Hey, Big Money Bound TV. So The depth of clinical judgment section will be organized around the following elements. It's going to be patient types, which is chronic airway disease, trauma, and cardiac. Settings, in hospital, out hospital. Patient ages, neonate, pediatric, adult. Clinical activities, information gathering and decision making. That was all in that clinical sims. Okay, so I'm going all off of what I wrote down for my highlight points. I'm just hitting the highlighted points. That's what was important to me when I was reading through it. The board intends to maintain standards for achieving CRT and RRT credentials in the future rather than make it easier or more difficult. How is it not becoming easier, bro? How is that not? Drop down in the comments, let me know. Is this much more easier? How is this not becoming easier? I just went from 2 4-hour tests to one damn multiple choice question with 160 questions on it. And I think only 140 count or 120 count or something like that. But it's only one test. It's one test. The test that we have now in place when you got a CRT score and RRT score is the current thing what they're gonna do. They're gonna just eliminate the second step of passing the clinical sims. How is that not easier if I don't gotta take that whole second step and go to my clinical simulations where people are having trouble passing? If the clinical simulation passing rate ain't 100%, where everybody just passing it, to get to that, so once I go there, it's a chance I can fail. How is it not much easier if I'm passing the RRT level and I'm not going over here again, where people are going over there and fail and they can't pass it? Hey, I don't know. Take it how y'all want to take it. Maybe it is the same for y'all, but it's not making sense to me. I got one written test and I got one clinical sim test. Now we scratching out that clinical sim test and all you got is just the one written test. How is that not easier? All right. Starting in 2027, those who earn a CRT credential must select enough correct responses in the clinical judgment portion of the examination to pass overall. So now, I can become a CRT just by passing one damn section? Ain't even the whole test, I'm just doing one section. I just got my CRT section right and I'm good. But I missed all the RRT section and now I'm a CRT though? I'm still a respiratory therapist? I'm just certified? Maybe I ain't comprehending this right. Starting in 2027, those who earn the CRT credential must select enough correct responses in the clinical judgment portion of the examination to pass overall. Whereas they have been able to bypass a deep clinical judgment assessment by avoiding a simulation examination. Okay, it's a lot of writing in here that you got really So they got to pass the clinical judgment portion of the examination to pass overall. Whereas they have been able to bypass a deep clinical judgment assessment by avoiding a simulation exam. They have been able to bypass a deep clinical judgment assessment by avoiding the clinical simulation. You saying it yourself. I'm able to bypass by avoiding the clinical simulation. A deep clinical. I'm avoiding that shit. And I'm a CRT now. I'm avoiding it. How is that just as challenging? How is that not easier or more difficult? How does that remain on the same level? See, I don't want to keep going at NBRC because these people feed me. And you got to you got to pay your dues every 5 years. So NBRC, I'm just reading and I'm just making some content. So don't come after me saying, what's his name? And hey, I need my money. I love, hey, respiratory therapy, save me. I'm just reading what y'all wrote. Bring me on board and we can fix the terms and terminology. We can make this a little bit better to understand. That's something. I ain't gonna say we can make it make sense. Make it a little bit more better to understand. For people like me, that's just happened. Okay, so let's become a CRT. Those who earn the RRT must at least equal the high standard that has been associated with the critical. Hold on. It don't make sense. Must at least equal the high standard that has been associated with the credential since it began in 1961. So we taking this shit back to the old days when we know the test was completely different back then. But I must maintain that same high standard that's been associated with this credential since it began in 1961. So that's my cutoff score, the same one that was back there in 1961. And you say it ain't easier? You know what? I'm gonna go take it. I'm gonna go see it. Nah, because I'm even trying to fail that bit. Let me take my license. Hey, I got mine. Go get yours. I got a couple Q&As. It was a couple Q&A questions, and I highlighted the ones that I thought was important. It's a couple Q&A questions on here. All right. What if I pass the therapist multiple choice examination at the high cut score and don't successfully complete the clinical simulation before December 31st, 2026? So now that means you're going to go into January 2027 and they got the new test mandate rules. All right, so the clinical sim examination will be available through December 31st, 2027 for those individuals who pass the TMC at the high cut score prior to December 31st, 2026. So why in the hell? I'm sorry. I'm not trying to curse or question them, but it don't make sense. If y'all finna change the examination in 2027, making it a little bit easier, but if I pass with a high cutoff score in December 20th of 2026, I still got a full year to become an RRT, but I gotta take the clinical simulations. If I just wait 2 more weeks and take the test in January 10th of 2027, I just gotta pass 1 exam. Why the hell would I go? I'm sorry, y'all. To me, it's funny and it ain't making sense. Why in the hell would I go and take the exam before 2027? Everybody I just wait. I would just wait. I don't care. If you graduated in May of 2026, you don't want to wait. Let me keep reading. Okay. The computer simulation exam will be available through December 31st, 2027 for those individuals who pass the TMC, and that's the multiple choice credentialing exam at the high cut score prior to December 31st. Alternatively, individuals may also take the new examination and pass at the high cut score to earn the RRT credentials after January 1st, 2027. So I guess if you don't mind spending the money, like if you having difficulties, you're having some troubles passing the clinical simulation, you can just wait till January 2027 and just take that multiple choice examination again and pass with the high RRT cutoff score that you just passed it before, and not have to worry about the clinical simulation. So now that's more tests that you got to pay to take. Okay, but hey, then it says, as we work towards implementation in 2027, we will keep you updated with new information posted on our website and social media outlets. We look forward to these exciting changes coming to the respiratory care credentialing system. Yeah, that is very exciting. But why would you have to keep me posted on new information about the exam if y'all saying this is what it's going to be? If this is what it is, like y'all should have it written in stone. If this is what it is, this is what it's going to be. Hey man, shout out to MDRC, dog. So, to me, this is easier than what I had to take, man. Let's go down the rest of the questions though. How many questions are on the respiratory therapy examination? The examination will have 160 scored multiple choice questions. All right, 160 scores. All right. What is the time limit for the examination? The examination time limit will be 4 hours, administered in 2-hour sessions with a 10-minute break between sessions. Candidates who finish the first session in less than 2 hours may begin the second session when they are ready. Candidates may also choose not to take the 10-minute break. Now, I ain't gonna lie to y'all. When I went and took my examination, it wasn't no 2 sessions and it wasn't no breaks. But I guess they're doing they're doing the clinical judgment part, and then they're doing the basic knowledge part, like you knowing your equipment, your flows, your tanks, and then you knowing like how to treat actual patients. So that's your clinical, and it's just your basic knowledge of like how does COPD work, what is it affecting the lungs, how many lungs you got, how many fistulas, and all of that stuff. Okay, and then it's like, next question is, how would a CRT and the RRT credentials be awarded to passing candidates? Well, we already answered that. The examination will have 2 cut scores that determine whether passing candidates receive credentials as a CRT or as a RRT. Individuals achieving the low cut score earn the CRT credential, and those who achieve the high cut score earn the RRT credential. Like I said, Oh shit. As I'm reading on the side right here, it says recent posts. Let me tell y'all what it says. BOGO deal. Specialty exam, second chances. Free guarantee for NBRC. Oh yeah, I heard about that. So if you're taking a specialty exam like acute critical care specialist, asthma educator, PFT, any specialty, if you buy one and you fail that one, you get a free second attempt. Just buy one, get one free. You can take a second exam for free. All right, so now we going here. Here go to 2023 examination in review. So it's going to tell you examination administered and credentials awarded. It's going to tell you how many people took the exam and how many people passed it in 2023. And like I said, this is from the NBRC website. Randy not on here. He just on here making up stuff. Why he always doing that? He already know, man, this is Big Money Bound TV. I know what I'm doing and I'm talking about. This is serious. I'm just from the horse's mouth. All right, so it said in 2023, they administered 23,156 NBRC examinations and awarded 13,131 new credentials in 2023. So, damn, about 10,000 plus failed. And that's in 2023, when I say it's much more difficult. As of December 31st, 2023, the total number of NBRC credentials awarded reached 549,923. And that's just since NBRC has been like credentialing RRT. So that means since 1961, it's a total of 549,923 respiratory therapists that got the credential. Okay, so here go the examination. In 2023, for the therapist multiple choice exam, 11,364 people received that CRT credential. No. Took the CRT cutoff score. Hold on, what the hell? The way they got it, man, it ain't me, it's the way they got it written, bro. 11,000 people, 11,364 people took the therapist multiple choice exam. Out of those people, 6,025 were awarded that credential. That's a 53% passing rate. So that's who became the CRTs, who took that exam. And that's just the CRT cutoff level. They ain't go to who took the who became RRT. That's who just got stuck at the CRT level. Like they couldn't pass that multiple choice. They couldn't pass the therapist multiple choice exam at all. So they ain't counting the people that got that RRT cutoff score and they went to take the clinical sims yet. We ain't counting that. This is just the people that took the exam and got CRT or they failed. So that's 53% passing rate out of the CRT exam. Now for the clinical simulation, 58% passed. 58%. 9,173 people took the exam. 9,173 people took the exam. 5,334 people passed the exam. So, when it came to clinical simulations in 2023, 5,334 people passed. When it came to the therapist multiple choice question exam, 6,025 people passed. Which one seemed harder? Damn, so you gotta really read this stuff, man. So, like I said, I just broke it down to you how like it's gonna be much more easier to become a therapist. You taking one exam instead of taking one exam and one damn computer simulation. This one no exam, this was a simulation. This was like they tell you you can do one thing wrong, it'll take you for a whole hula hoop, and you'll be right back thinking everything good, but you wrong. And you can say, oh, I'm gonna put the tidal volume at this rate. You had to know like what tidal volume you was gonna put, the size of the patient, and what not to do. And it wasn't field based, it was exam based. So what you do in the field and what you do in the exam place is two different things. That exam was tough, man. That exam was tough. So that's where we're going from now. But moving on. You know, I'm looking at articles. I found another article online that may interest you. Now it's easy to become a therapist. That's by passing the national board exam. Now to become a respiratory therapist graduate from a program, that's a whole nother ballpark. That ain't easy, but it's possible. The board exam was easier than my program. The program was 2 years of multiple damn tests back to back to back to back. That exam, like I said, was a couple hours, 4 hours, and you come back and do another 4 hours. That was easy. That's 8 total hours. I logged in a whole bunch of work hours in them 2 years. So that program is harder than a board exam. So it's easy to become a therapist, Because you got to become a therapist, you got to pass the board exam. But I ain't saying it was easy to get their program, so don't. Randy said it was gonna be easy. And hey, no, don't go on outside and shit like that. Artificial intelligence for mechanical ventilation, a transformation shift in critical care. Whoa, so y'all bringing AI to mechanical ventilation in ICU? But a respiratory therapist takes care of the ventilator in ICU. So y'all gonna phase the therapist out? Hey bro. I'm just reading what they put out here, bro. I'm reading this article. And this is from, who the hell this from? Hold on. Let me see who this from. Hold on, I don't know who this from. Who the hell this from? Hold on. I don't know who this is from, boy. Who this is? Advanced Pulmonary Critical Care Medicine, 2024 November is when it was put. And it's NLM providers access to scientific literature. NLM database did not implement endorsement or agreement with the contents by the end. Okay, y'all kind of hold on. So it's an article from the National Institute of Health. All right. And that's what they saying. Let me see, bro. I found the right information I wanted to really hit on. What was it at? Okay, here we go. This one. The use of artificial intelligence for mechanical ventilation. Artificial intelligence, AI, could help the management of patients treated with mechanical ventilation in critical care practice. Current guidelines, so they telling you what's going on currently. Basically, they're going to say, what's going on currently ain't really cutting it. You got to bro. You got to read. If you really read and be on these articles and books, and man, this shit will scare you out here, boy. They said, you want that red or that blue pill. Because you really want to know what's going on, this shit will scare you, boy. Current guidelines are based on data coming from the general population without considering the individual patient's characteristics. So it's telling you right now, they just going off just to, the general population. They ain't making it precise to your body type. Already you talking bad about respiratory therapists already. Without considering the individual patient's characteristics, like how much they weigh, like how long they've been smoking, like their lung elasticity. That's what's going on now. So they saying it ain't really the best. It could be better. You don't want nobody going against combating like what you doing to make a living. As I'm reading this shit, I'm getting scared. But with the use of AI for mechanical ventilation, critical care practice could be improved. So now if we're using AI technology, we can improve it. We're using humans, but if we go AI, it can improve. I'm reading it and I'm getting scared. But I'm gonna keep reading because I love the supporters. It can be improved by offering personalized treatments, reducing complications, and assisting clinicians in decision making to improve patients' outcome and reduce mortality rates. Now, if I come in your room, your family member is being ventilated, and I say, hey, I know we got a respiratory therapist out there taking care of your mother, your father, your brother, your sister, your family member, right on the ventilator. But what if I say I can offer you a better alternative of mechanical ventilation for your family member? And this is what it's going to include. And I give you this whole spiel. With this AI ventilator, this is going to help. See, I'm doing this as a person studying it to you, bro. With this AI ventilator, this is going to help improve your family's outcome by offering personalized treatment. Personalized? Shit, he ain't really doing personalized. He's taking care of a couple patients in here. Okay, personalized treatment, reducing complications. The complications that the human cause is going to reduce those, but he ain't causing complications yet. But it's going to reduce those that he could cause. All right. And assisting clinicians in decision making. The machine going to help them. Oh, we all use computers, so that's kind of okay. To improve patients' outcome and reduce mortality rates. Hold on, reduce mortality rates. Yeah, bring that AI machine in here. Bring it in here. If you give me nothing but improvements, how it's gonna be better than what the human is doing. All right. Despite AI in medicine, Despite AI in medicine has progressed in the last decade, little is known about its use in critical care. Use is known. Despite AI in medicine has progressed in the last decade, little is known about its use in critical care and in ventilation management. In order to improve its everyday use, future research should be performed in intensive care settings. Now, whoa, now you ain't say that first before I sold this to the damn patient. Now, when you say research, you mean like trial and error. You ain't finna put this ventilator on nobody's family member, life or death, saying trial and error. That's what I think gonna be the hard part. You feel me? Unless they say, okay, your family been in the hospital for a while, your medical bills are getting racked up. If you are willing to let us try our AI mechanical ventilator on your family member, we'll cover y'all medical, we'll take care of y'all medical expenses. Now y'all may be like, shit, hold on, it's getting expensive. It ain't looking good. Why not let them try it? And then they're gonna cover the medical bill. That's how they'll come through and that's how they'll do this stuff, man. Especially they'll go down to the, you know where they're gonna go with this stuff. They're going to the communities. Cause if I got money, you ain't finna come in here and experiment nothing. Now if I ain't got it, I'm wondering how the hell we gonna pay for all this here? You go to a lower income area, you know how that's gonna be. They go, man, the rest you already know. But that's where they going with that. And I'm through with it, man. So that's how I feel about the situation. Y'all let me know how y'all feel. Do y'all think it's gonna be easier? And that AI ventilator stuff, that sounded a little crazy. That sounded a little scary. But when you say more research has to be done in the critical care setting. So y'all ain't did no research on a real human in a critical care setting. Y'all just talking and saying what could be, and because it's a machine, man, get out my damn face and put some. Man, my family fighting for their life. You talking about some coming here and experimenting. Well, how about you go get your family member and experiment on them? Let's put them in the same bed, hit them upside the head, cause some trauma. And you know what? I want to get monetized. Thank y'all for watching. Y'all be easy.